We are an addiction medical home, so we treat patients for primary care for things like diabetes, hypertension, or sinus infection. Then we also do medication-assisted treatment for addiction, and then we do behavioral health services. We offer individual and group therapy here.
My name is Joyce Johnson. I am the Clinical Director of Outpatient Services. I've been with Intensive Health for 4.5 years, and I've been in the Clinical Director role for 2.5 years. I hope that Intensive Health gives patients a community that they can develop for themselves. I hope that Intensive Health in the long run assists people in improving their lives and continuing in long-term sobriety. My main focus when helping the patients is to make sure that they have the resources that they need to be sober, they have the resources that they need to create a community, and they have the resources that they need to live a healthy lifestyle. With the pandemic, our patients have experienced a lot more mental health crisis. They've experienced a lot more overdose and a lot more relapse. This is challenging for us as providers, but it's also challenging for patients to continue down the path that they want to be on in the face of such adversity.
I take in all the new patients. I take all the requests when someone calls and says, I want to come to your doctor's office or I want to get addiction treatment. They come to me first. And so then I kind of figure out what they need, invite them in to sit down and do some paperwork and get them in our system, make sure their insurance is taken care of, make sure that we just know who they are, that they understand what they're coming for, and that I'm getting them scheduled to the right people. The way I try to help the patients is by getting them past me to the people who really know what to do to help them. And so what I want to do is make it easy for them and comfortable to come in. When you go to a new place, you don't know how it all works. I want to make it really easy and simple and comfortable.
Our patient population often feels hopeless, so it's really nice to work in a place where we can cheer them on and watch them succeed. All of our patients really mean a lot to us, so on the rare occasion that we lose one to overdose or another type of illness aside from addiction, it's really difficult. Addiction never stops, so we don't get to either. Even though a lot of places have shut down because of COVID, we have had to go above and beyond even more because it has been so difficult for our patients. So knowing that they need us is kind of a driving force for me.
It's frustrating because, when you really care about someone, you want them to be healthy, you want them to take care of themselves, and it's just, sometimes it's very hard to get them to follow direction. And that's all patients, our primary care patients, as well as our MAT patients. To get a person to get on a medication regimen, even like a person with diabetes, to get them to follow that, to stay on track with that, it's almost impossible.
A peer support specialist is a person who has a lived experience with addiction, mental health issues, and then the experience of recovering from those issues, kind of learning how to live and thrive in society while simultaneously dealing with those issues. And then they use that experience to help people like them.
We schedule all the appointments, we take the phone calls, we do medical records requests, we pretty much make sure the flow of the office is smooth, get the patients in and out, and get them rescheduled. The biggest struggle, I think, for the patients is trying to get here. Not a lot of them have transportation or having to take off work to come in for their appointments. A lot of jobs are not very understanding when people are trying to get off to come to appointments.
The best part of my job is the patients and getting to have a hand in their recovery journey and just see their growth in all their aspects of their life, especially when you see them from day one and they literally are at rock bottom. Then seeing them in the next time and just watching them grow and the goals that they meet, and even their appearance, how much healthier they look, and just everything. That it's humbling and it's inspirational, and I learn so much here too.
Because I love my patients. I truly do. I love my job. So there's no question. There's just no question. I would do it. It doesn't matter.
Well, we give everybody a goal and a purpose to work towards. We encourage them in their recovery. We don't work harder than they do for their recovery, so we encourage them all to take part in that and to keep going and moving towards their goal.